So I'm Rebecca Brady. I'm the Ohio AAP Medical Director of the MOBI program, and I'm going to be discussing immunization, reminder, and recall interventions. The three objectives are first, to define immunization, reminders, and recalls. Second, to present some examples of immunization, reminder, and recall strategies. And third is to discuss the benefits of and barriers to use of reminder and recall interventions for immunizations. Reminder and recall is the single most effective way to improve immunization rates in a practice. What is immunization, reminder, and recall? So you're reminding parents or providers that a vaccine is due, and then you recall children who are past due for one or more vaccines. The reasons to do reminder and recall are to raise immunization rates, to heighten awareness of staff members of the continual need to check the immunization status of their patients, and to provide a service to parents to help them keep their children on time with healthcare visits and vaccines. The recommendation of a healthcare provider is a powerful motivator for parents to comply with vaccine recommendations and has been shown to be the most important motivator. Healthcare providers should reinforce the need to return on time using verbal, written, and calendar-based methods. Reminder and recall increases the data quality in immunization information systems by collecting more complete and up-to-date information. It also enables immunization information systems to support providers and provides them with tools to conduct immunization, reminder, and recall more efficiently. What I'm going to be discussing is the 10 steps of immunization, reminder, and recall, and this is from the American Immunization Registry Association, and their website is listed on this slide. First, you need to formulate reminder and recall criteria. Who is responsible for initiating reminder and recall? Is it the provider office, some sort of local public health agency, or are you using an immunization registry such as Ohio's system, which is called ImpactSIIS? Ohio's new ImpactSIIS, and there are changes that are going to be coming out. We're transitioning to a new system, which will have a more user-friendly interface. We'll be able to forecast the schedule. We'll have 500 reports that are available, and we'll have more advanced inventory ordering and management tools. Ohio's new ImpactSIIS will enable the office to do reminder and recall using labels, postcards, letters, emails, and auto dialer text files. And to orient everyone to this new system, the Ohio Department of Health will be offering online training sessions. So you need to specify what the goals are of the reminder and recall. For example, are you going to target a specific age group? For example, based on well-child visit timeframes? Are you going to target a specific vaccine dose? Or sometimes you target based on school requirements. Sometimes you can use data from APHIX or other surveys to determine the best time to perform recall notices. So the fourth dose of DTaP vaccine is typically the lowest on-time rate for 2-year-old children. So you might want to consider sending a reminder to parents to let them know that this vaccine is due at 15 to 18 months. And you can use APHIX or other data to determine when children miss their vaccinations and then target that age to improve rates and outcomes. If you're doing reminder notifications, those should be sent 2 to 4 weeks before the recommended due date or date range for each recommended vaccine or vaccination visit. And they recommend 1 reminder and then up to 3 follow-up recall notifications for each recommended vaccine or vaccination visit for children between birth and 6 years of age. The second step is sometimes defining additional conditions. So reminder and recall has to be done in line with available staffing and other resources. Not every recommended vaccination will result in a reminder or recall notification, and priority is often given to recall notifications for children between birth and 24 months of age. Third, a list of potential patients need to be generated. So, for example, that list might be all children who are due for a 15-month well child care visit in the next 4 to 8 weeks. You need to define who the responsible staff person is for generating that list, and then the staff will generate a list of potential patients that meet that criteria. Fourth is to revise the list of potential patients. So some children may no longer be coming to your practice and may be receiving vaccines at an alternate provider, for example, the health department. Other children may have moved or for other reasons are at a different healthcare provider. Fifth is to select the reminder and recall notification method. So who should receive the notification? Usually it's to the parent. Adolescents, you may also want to send a reminder to the adolescent as well. What type of notification method are you going to use? Is it going to be postcard, a letter, some sort of electronic text message system? What you're going to say in that notification as far as the actual content. You want to be positive and understanding. You don't want to make them feel guilty even though the child may be behind on the vaccines. How frequently do you send the notification? And then using the most cost-effective notification method based on the resources that you have available. So these are some of the different methods for reminder and recall. So you can do person-to-person phone calls, providing you're actually getting to speak to a person. There's various auto dialer phone call systems, text messages. Postcards can be something that is based on a generated list or a tickler system. So they come in, they get a dose of a vaccine. Actually, at that visit, you have them fill out the postcard. That way you know the address is correct. And that may be mailed a few weeks before the next dose is due. Letters. There's electronic reminders that can be done using the various electronic medical record systems or also through ImpactSIIS. And there's patient portal alerts that send emails to patients or parents, prompting them to check the patient portal for a needed vaccine. This just looks at the cost effectiveness of reminder and recall methods from the most to the least cost effective. So the most is actually cost effective is the telephone call, provided you're actually person to person, because if you actually can get the person on there, then you can actually not only tell them that the vaccine is due or past due, but you can actually hopefully set up the appointment for them all at the same time. Second is the letter. Third is the postcard. 4, auto dialer. 5th is home visit, which I don't think is done very much, obviously because of the cost involved. This just looks at the effectiveness of reminder and recall. So this was comparing a manual postcard system in the mail with a computer-based telephone system and auto dialer. The average cost per child was $2.28 for the mail group and $1.47 for the auto dialer group. The auto dialer group was more cost effective in delivering immunizations, but really that was true more for larger practices than smaller practices. And this was a study that was published in Pediatrics in July of 2000. This next is a more recent study that was published in the Journal of the American Board of Family Medicine in 2015, looking at the effectiveness of office electronic medical record systems as far as generating alerts for HPV vaccination. This resulted in a 9% increase in dose 1 rates, an 8% increase in dose 2 rates, and a 13% increase in dose 3 completion. Each dose of vaccine was accelerated by 151, 68, and 93 days, respectively. And although these numbers look small, you have to remember that the rate of 3-dose HPV vaccine receipt for boys in Ohio is only about 21%. So that 13% increase could be a major sort of increase. These are some of the different auto dialer vendors that are available. AAP does not endorse or recommend specific products or brands, but these are some of the different websites that you can refer them to if they want to learn more about these auto dialer vendors. 6, you need to change the notification method for some patients. So if you've sent out letters, 3 or 4 letters, you haven't got a response, then you may need to consider a different method. If it's just a postcard, then maybe you really do need to try to make a telephone call now. Sometimes combining immunization reminder and recall with other notifications is important. So for example, if your adolescent is going to be needing a summer well visit or a sports physical, also try to tell them that there may be vaccines that are due at that visit also. 7 is conveying the reminder and recall notifications to the patients. So if it's a telephone call, you want to somehow record that you've made that telephone call in the electronic medical record. You have to consider time of day that you're going to be placing the phone call. So you may need a cell phone, you may need a work phone if you're doing this during the office daytime hours. And then you have to decide whether you're going to leave a message if no answer, or what that message is going to be. Is it just going to be general, call the office back? Or are you going to say this is related to a vaccination? With a letter or postcard, one of the big things is getting the correct address, and then decide who the responsible staff are for addressing and mailing those letters or postcard. Email communications, the same thing. You've got to confirm that you have the correct email address and decide who the staff is that's going to be responsible for sending the email. The 8th step is to collect reminder and recall responses and update the status. So did the parent or the patient respond back to the notification? Did they actually schedule an appointment? Was it for a well child care visit or an immunization only visit? Did the patient come to the appointment? And did the patient receive the needed vaccinations at the appointment? 9th is updating the individual patient information in ImpactSIIS. So once they come in and get the needed vaccines, update the office electronic medical record system and also the state registry, which is ImpactSIIS in Ohio. And then asking the patient or parent if the notification with strategy was useful, especially if you had to use more than one strategy for them, which one really worked for them. And number 10, evaluating the reminder and recall results, sharing the results with others, and planning future reminder and recall strategies. This is just a list of some of the barriers to reminder and recall. So obviously this takes staff time and financial resources. Often, depending upon the particular electronic medical record, there may be difficulties with the technical capability to run reports and use the data from the electronic systems. Often there's low confidence in the accuracy of patient immunization records if there's a lack of data sharing among multiple immunization providers. This usually does result in some changes to staff workflow, and oftentimes those changes are not met very positively, at least at the beginning. And then uncertainties regarding the success of reminder recall interventions. If they've tried things in the past that haven't worked, they may be hesitant to try a new strategy. These are some of the American Academy of Pediatric resources for reminders and recalls. The AAP has developed web pages with resources for providers to encourage reminder and recall systems. We've got 2 of the links there. Both of these resources provide good information for making reminder and recall systems work. And remember that reminder and recall is the single most effective intervention to improve immunization rates in the practice. I'd like to thank you for your attention. There is a short quiz that you can complete by clicking the link below.